All right, Smooth 98.1, love music, love life on a feel good Friday morning, 11th day in the month of October 2024. It is your love music, love life station and the Smooth Breakfast. Your perfect start to the morning. Ayokunmi is your your host this morning. Yes, taking you on a journey into great conversation. That's what we do 9 o'clock in or during the weekdays. Lagos Talks is what you're listening to. Welcome as we get into the world of conversation. It is all about the girl child today. Today is International Day of the Girl Child. So that is where we are pitching our tent this morning to have great conversation. And I welcome you to a special edition, as we celebrate today. Now, we're going to focus on an important topic, and it has to deal with health and well being. Girls' Vision for Accessible Healthcare. The theme for this year's International Day of the Girl Child is Girls' Vision for the Future. And hey, why not talk about Girls' Vision for Accessible Health Care? Now, as we explore girls' perspectives on their health needs and their vision for a future where healthcare is not just a privilege, but a basic right, we'll also dive into what must change to create a more inclusive and accessible healthcare system. And joining me today to talk about this is someone who is definitely very well versed in those matters. I mean, years and years and years of experience in that field. I'm talking about Dr. Muti'ah Badruddeen. She is the reproductive health physician. Very good morning to you, Dr. Muti'ah. Great to have you on Lagos Talks this beautiful Friday morning.
Thank you so much. Good morning to you, and thank you for having me.
It is a pleasure. I love having brilliant minds in different sectors to come on and share their wealth of knowledge on certain issues. And this particular one is, should I say, a sensitive one and one that really stands out and one that needs a focus and a spotlight being put on it. And for all our listeners out there, all the great women out there, all the great men as well, you are not left out of this conversation. We need you to weigh in on this. We need to hear your thoughts, your perspectives, opinions, feelings as well. And you can come through on WhatsApp to share them with us. That's one way. The number is 0809 444 0981. 0809 444 0981. You can give us a call on there as well if you are not in Nigeria, for example, you're in diaspora, or it's more convenient for you. You can also call on the studio line. That is 0201 4489 0201 4489 We're also streaming live on YouTube, where you can also catch this session at the end of it for reference, share to your friends, your loved ones, sisters, nieces, and so on and so forth. That being said, let us begin right at the very beginning and look at the current state of girls' health and well being. Now, globally, adolescent girls face significant health challenges, particularly in developing countries. Now, from menstrual health to access to nutrition and reproductive health services as well, many girls are actually left vulnerable, unfortunately. Now, according to UNICEF, millions of girls lack access to basic healthcare services, leading to increased risks of disease, of malnutrition, and sadly, even death as well. Now, Dr. Mutia, my first question to you this morning is, could you share some insights into the most pressing health challenges that girls face today, particularly in undeserved communities? I mean, from your years of experience in this field.
Um, I think it's interesting because you kind of already touched upon it in terms of the most pressing challenges that girls face being access. And I
Mm,
know that that sounds really vague because it's such a broad, word, access, but you have to understand that access encompasses a lot of things. So girls lack basic access to basic information about their sexual of their about their health issues, for example. They lack access to the technology and the infrastructure, especially in underserved communities like
mm,
Nigeria. I like to use Nigeria as an example, where even the things that we do have tend to be concentrated in urban areas. And so the
okay.
majority of girls in the country, because the majority of Nigerians are not the people in the urban areas. They still do
Mm,
not have access to the very meager, infrastructure that we have. And even that infrastructure is very, very low quality compared to what state obtains elsewhere. So
okay.
there's, lack of access to information, to technology, to infrastructure, but also to just like the pharmaceuticals, the newly developed therapies and remedies. All of those things are things that we don't get. And I think what will resonate to most listeners is the lack of access to personnel. If we take
Mm,
doctors as an example, because I'm a doctor myself, so that's the one I'm most conversant with. But the WHO requirement for doctors or recommendation for doctors per population is one doctor to at least 1,000 people or to at most 1,000 people. As at,
okay.
I think that was 2021, the Nigerian Medical Association was lamenting that less than 80,000 of the, less than half of the 80,000 doctors that were registered with the MDCN were actually functioning in Nigeria. That puts the population per doctor of Nigeria to about 4,000 to 5,000 people to one doctor. I'm
Mm,
going to say that again. You're supposed to be
mm,
1,000 people to one doctor, but in Nigeria, we have 4,000 to 5,000 people to
to
one
one
doctor.
doctor.
And then you can imagine that if you were a girl living in a rural somewhere in Nigeria, that number is going to be significantly higher. So when we say access, when we say the most pressing health challenge is access, I mean
Right.
across all board. It's not just, you know, something that we say, but it's something that is on ground in terms of everything, literally cuts across literally everything in terms of healthcare. And there's no way you can get any meaningful improvement in healthcare when you can't even access the care. You can't even access information about the care. So that's why
Mm,
I say that the problem that we are having for the girl child in terms of healthcare is primarily a problem of access.
mm. Now, talking about this access, I mean, looking at things from the point of view of those who are living in the urban areas, those who are living in the rural areas, at least in Nigeria. I mean, is there really much of a difference in the barriers affecting those living in the rural areas and the urban areas, or is it something that, hey, it affects them in this way, it affects them in the same way here, or there are different factors
There are different
affecting both?
factors. Unfortunately, there are different factors. So in the rural areas, for example, it's just not there. The possibility of that access is just not there. There's very limited resources. There's very limited, infrastructure. There's very limited personnel. It just does not exist. If you're lucky, you get like a health center that is manned by a community health worker or something, and maybe a rotating nurse from time to time. But in the cities, in the urban areas, you actually have the infrastructure there. There's a plethora of, government hospitals and healthcare centers and private centers as well. And so the
Mm,
problem in those areas then become a problem of finances much more than availability. You see the difference? In the
right,
rural
right.
areas, it's just not available. Then in the urban areas, even though it's available, you have to then contend with, your financial status in terms of what then becomes accessible to you.
Mm. All right, interesting thoughts there. Now, I'm going to hold on to something like you mentioned. You talked about in the urban areas. Let me even focus on that for now. The urban areas, there's a plethora of options in terms of healthcare centers and all that. But it's one thing to have those healthcare facilities. It's another thing to have the requisite knowledge about them, what they're there for, where they
Mm,
are, what they can do for you, and so on. Which brings us to the role of education, which plays a very big part in improving healthcare outcomes for girls. Now, I believe that when girls are educated about their health, they are more likely to seek medical care,
mm.
practice safe hygiene, advocate for uh, their health rights, and so on and so forth. And I want to also believe that schools can serve as a platform for this. Now, that being said, how does this access to education actually influence girls' ability to understand and advocate for their own health rights? And are these things that schools should actually be playing a greater part or a greater role in doing?
I mean, definitely. In and of itself, the role of education is to help you form into, the best version of a human that you can be. And unfortunately, that's not always the case. mm, in our society. But
Right.
if, done properly, done right, education should give you the access to information, yes, but also the confidence to be able to imagine and dream beyond the world that is available to you. Because if you
Mm,
cannot imagine it and you cannot dream it, then there's no way you're ever going to get it. And this is the problem with, most of the time when it comes to being uneducated and being able to access anything really, or being able to advocate for yourself. If you don't nobody is paying attention to you in a manner that helps you develop, and that's the case with most of the young girls, in a manner that helps you to develop into a confident human being that goes after what they need, then how are you going to do that? And that brings to the question of, yes, schools should definitely be doing more in terms of health education, not just of the girls, but all of the students under their care, but particularly
mm,
for girls, because girls are socialized to not ask for things, to be self effacing, to be quiet and patient, and all of those things, which is good,
mm.
but is
And probably
also
not even to talk about issues like that.
exactly. So even though those things are good qualities, you also have to be able to talk about things when you need to talk about things. You have to be able to go after things when when you need to go after those things. So part of that is, if you had a school system, not just one school, but a system where children are educated to be able to ask questions, be curious. One of the things that I have noticed over time has really declined in the Nigerian educational system is curiosity and thinking outside the box. We have a very rote learning of system. Okay, so this is the answer. They cram it, they come to the exam, or they point out. And then you're talking to adults who have passed through the systems, and there is no intellectual curiosity. There is no, nobody is trying to think outside of the box. And that is a major problem. So back to your original question, I'm rambling now. Yes, schools do have, they do have a huge responsibility and the
Mm,
capability to help children, particularly girls, develop into individuals that can advocate for themselves and try and find health information. But it has to be a culture within the school system of encouraging curiosity in these children, of helping them know that you can always look for information even if you don't have it now. It's okay that you don't have all of the information, but you can always find it. you know that culture has to be imbued and built in them from school. It's not just about coming to school, health science, and they tell you some things, you cram it for exam and you submit it. That's not what it's all about. It's about being able to look for the information even if it's not there at the moment.
mm. Right. Very, very, very important words being said there. We'll take a quick break right now. When we come back in, you mentioned culture, and that is something that we are going to take a look at, addressing the stigma when it comes to talking about these things. I mean, where girls are concerned, the right information, and of course, the education that is required. Keep it tuned to Lagos Talks on Smooth 98.1. It's a smooth breakfast. Don't go anywhere. All right. All right. We're making progress. Making progress.
Yikes.
Get some water.
Reluxury in Emirates Flights from Lagos, with daily flights fly happy hours to over 140 destinations. Unwind in your first-class private suite. Dine on sumptuous cuisine anytime. Lose yourself in over 6,500 entertainment channels. Fly with confidence with fully flat nets. Fly Emirates first and take off on private flights. Book now at Emirates. Fly Emirates.
Right, and we are back in just a second. If you're just tuning in, this is Smooth 98.1, your love music, love life, and of course, your love conversation station as well. If you are just getting in with us, you're listening to Lagos Talks, where we have conversations about anything and everything, different issues. We bring them to the fore. We break it all down, and of course, get your thoughts, your feelings, feel your pulse as well. Today, it's all about the Girl Child. International Day of the Girl Child Special is what you're listening to. We're looking at health and well being, girls' vision for accessible health care. That's what we're talking about this morning. And my guest is none other than Dr. Muti'ah Badruddeen. She is a reproductive health physician. She is sharing quite a bit of knowledge with us on this matter because, hey, these are conversations that we definitely need to have. Come through and share your thoughts with us this morning on WhatsApp and the studio line. Now, the WhatsApp number remains 0809 4440981. You can call us on that number as well if it's more convenient for you if you're out of the country as well. And if WhatsApp is your thing, so there's that. You can also call on the studio line. That's 0201 4489981. 0201 4489981. We'd love to hear from you and get your thoughts this morning. Maybe take a message from, excuse me, from WhatsApp here. This is Michael. Michael says, how do you educate young girls when surprisingly a lot of female adults are actually ignorant of a number of things? I know more about the female body and psyche and even female sexuality than most adult females because I read. It shouldn't just be for the young schoolgirls, educationally and culturally. Dr. Ntia, what do you have to say about that?
I do agree with part of that statement in the fact that, yes, a lot of women, unfortunately, do not know enough about their bodies. It's something that I find in my practice a lot. It's also one of the reasons why I started my social enterprise, because we can't continue to exist in ignorance. And at the same time, you really cannot blame people for what not knowing what they do not know, especially in a culture where we have for so long stigmatized, talking about these issues. So the best we can do is to, try to improve access to that information, and things are getting better. We just have to keep working at it. So yes, it should not just be for the girls in school, it should be for everyone. I do agree with that.
Okay. And of course, talking about stigma, because it's actually really funny that Michael brought that up because before we went back in, sorry, before we went on that break, I was talking about we'd come back in and talk about the stigma. One of the most under discussed yet very crucial aspects of girls' health is reproductive health. There is no doubting that. Well, now many girls are not provided with adequate information about their bodies, menstrual hygiene or sexual health as well, which can lead to a myriad of problems, talking about unwanted pregnancies, unsafe abortions, STIs, all these are the after effects of this lack of the needed information. Now, addressing these issues requires eliminating that stigma and normalizing these conversations around girls' reproductive health. Now, Dr. Muti, like I said, it remains a sensitive topic in many communities. I mean, how can we break that stigma around it and ensure that girls receive the information and services they need so that, just as Michael has all that knowledge, girls can also be comfortable enough to be able to seek for this knowledge and have it as well?
Mm. Yeah, so breaking the stigma really would come from normalizing these conversations, just like you said. And being able to do that within our community requires us to engage individually, yes, but also as a community. And I mentioned earlier about starting a social enterprise myself. One of the things that we do, or the major thing that we do, is provide sexual and reproductive health education and support to people from religiously conservative backgrounds, specifically Muslims, because this is conversations that we don't have. And there's a lot of baggage around that, but there's also a lot of distrust of
Mm,
anyone coming in with that information. So even if that information was available, which it is, a lot of people don't engage with it because of that mistrust. Oh, there must be an agenda, there must be something that they are trying to do, or whatever, or whatever, or whatever. And
right.
so I come in, or we come in as members of the same community. holding the same values, bringing you this information in a manner that is sensitive to our shared beliefs and understanding and, all the things that we hold dear,
Mm,
making it easier then for people to accept that information. So to answer your question, how do we, overcome this stigma? How do we make this information accessible? We're going to have to do it in a very culturally sensitive way. That's not always the case in the information that is available. Sometimes you find, you know, information and your own personally held belief is standing in your way of engaging with that. But if it's coming from
right.
someone who understands those beliefs, who is respectful of those beliefs, who is willing to discuss, have conversations, serious conversations about those issues and those beliefs and how they intersect, then the reception is so much better. And I think that that's what we should be doing, is to be looking at all of these things in our own lens and continue to have those conversations. It's very uncomfortable for a lot of people, but the more you have them and the more you get, the more comfortable you get, the less taboo it seems after a while.
That
And
is
as a
true.
collective, we begin to, lose that sense of stigma. It would not happen overnight, but it will, as long as we persist.
Persistence and consistency is very, very key. Having these conversations regularly makes them normal. And when they're normal, there's nothing uh uncomfortable,
Uncomfortable,
taboo
taboo about
about
it.
them.
Yep.
Okay, now that is a great way of looking at things. Now let's talk about mental health. Yesterday was World Mental Health Day. We had conversations centered around that. It was all about mental health at the workplace. But I'm bringing this into the realm of today's conversation. Talking about mental health as being part of the overall well-being of the girl child. It's often overlooked in
It is.
especially in girls who may be dealing with all sorts of different pressures. There's
Mhm.
school, there's home, there's society. There's always one thing or the other when it comes to the girl child, in terms of, when you grow up, you need to be this, you need to do that. So there's so much that is going on with them. Now, the lack of accessible mental health services, it tends to exacerbate feelings of isolation, anxiety can set in, depression can set in as well among them. Now, a holistic healthcare vision must include access to mental health resources and, of course,
Mhm.
support systems as well. Now, Dr. Muti'ah, from your experiences, how critical is the aspect of mental health at least when it comes to girls' issues, and what more can we do or can be done to make these mental health services more accessible to them?
Mm. The question of how critical it is, I mean, it will be undeniable that mental health care is important to the overall well-being of the child. We have the 1946 definition of health from the WHO, not just the absence of infirmity, but complete physical, mental, and social well-being, blah, blah, blah. So definitely it's important. But to be able to judge how critical it is, especially in our community, it will be very difficult because we haven't prioritized it. So we don't even know the full extent of what is needed to be able to gauge how critical the issue is. We have anecdotal, ideas of, okay, so girls seem to be suffering a lot from my personal experience. For example, I do happen to know that a lot of the younger women that I'm in contact with seem to be suffering a lot more from anxiety than we did when we were their age. There's a lot more anxiety, there's a lot more depression, there's a lot more feeling of social isolation and social phobia of socialization. But those are just
Mm.
anecdotes from my own personal experience. To be able to understand how critical that is, the issue is in our community, we need to, you know, put in more resources into actually having a system of mental health care and mental health care system and support for our people, which right now we don't. It's probably the only thing that's worse than reproductive health care in Nigeria right now.
Oh, wow.
So how do we do that then? Will be, yes, first to prioritize it, which we haven't. Again, people assume. The other day I was on Twitter, I saw someone tweet that you couldn't be depressed and be grateful to God. And I was like, I don't even have the energy to, like, unpack that. So I
I
just
don't
kept
I
I just kept
I don't usually
scrolling.
have the energy on Twitter. I usually don't have
Exactly.
the energy, really.
I sometimes I do, but that day I was just like, because where do you want to start from? There's still the very prevailing idea within our communities that mental health is a manifestation of the person's your lack of fear of God, your lack of gratitude to God, your lack of being a good enough person, your lack of something. And so that makes it very difficult because what comes with that perception, of course, is also the stigmatization of, so being able to even say that you have issues with your mental health means that you are opening yourself to judgment and
Mm,
you know people casting aspersions on your person or your belief or your faith or whatever. So yes, we have to prioritize mental health. We have to provide support, not just for the people who are living with mental health issues, but also for the people who are trying to address mental health issues. And it has to be systemic. It's not, that's the problem right now. It's mostly being very personal efforts on the part of a few professionals trying to do
okay.
stuff. There's very little systemic effort into dealing with mental health care issues in Nigeria, and that's sad. And so, yeah, prioritize it, provide support, and I will always come back to access and funding because without money, without access to all of that, it's of
Mm,
no use to anyone. So, yeah,
Money answereth a number of prayers,
in fact,
as,
it
as they
does.
say.
It does.
Oh my goodness. Okay, it very, very interesting thoughts that we're getting in on this conversation. And I've spoken to a number of people, especially when it comes to mental health issues. And like you said, it's picking up, but it's picking up, at a slow pace. Some people believe that, oh, once someone is feeling a certain way, oh, I feel depressed, I feel anxious, anything has to do with their mental health, they believe, oh, you should be able to suck it up, I
Mm-hmm.
mean, you should be thankful. Other people are going
Mm-hmm.
through worse,
Through
and so on and
worst.
so forth.
Mm.
And you just begin to wonder that why would anyone want to diminish another person's experiences? Because not everybody is the same way. Yes, maybe you went through a certain thing and you were able to, should I say, walk over the hot coals and get to the other side. Not everybody can actually walk on those hot coals and get to the other side.
Yeah.
And of course, different generations have different ways. They will say, oh, back in my day, we're tough. We did this, we did that, we fell, we got up. You break a leg, you get up and keep walking, those kind of things.
Mm.
But even then, they were going through certain things, but they just didn't have the labels for what it is
For
that they
it.
were going through.
Yes.
So, I mean, these are things that we definitely need to bring into consciousness, not for people to abuse them, because there's always propensity for that, for people to
Mm-hmm.
always
True.
every two market days, oh, my mental health is this, and so on and so forth.
Mm-hmm.
But they're real people dealing with real issues
Issues.
that need to be focused on, and the girls are definitely not left out of this one. Let's take another quick
In
break
fact, the
when we come
girls,
back in.
okay,
Okay, yeah.
sorry. I was going to say, in fact, the girls seem to be suffering a lot more, or maybe the girls are articulating it better. I don't know. But yes, the girls
Hmm.
are definitely affected.
Well, culture is something that definitely has a big part to play in that one, but story for another day entirely. Let's take our break and come back in and begin to look at technology as a tool for healthcare access. Lagos Talks on Smooth 98.1. That culture thing. Oh, you're a boy. She be a Korean. Okay, no.
Mm. It's so horrible.
I mean, that's why you then end up seeing a lot of maybe middle-aged to a bit older men. They commit suicide, or
Mm-hmm.
they're just yesterday on the conversation about mental health at work. Someone called in and sent messages that they were going through a lot of things at work. And someone said that a colleague or someone that he knew, because of a lot of stress in the banking sector, like for a month was incommunicado, like it just went offline
Mm-hmm.
for like a month because of all the stress and everything. And somebody will come and tell me that mental health is not. I mean, I'm
I
not.
mean, I've had period when I have gone on offline and just like literally unavailable to everyone except my children. I'm like, no, nobody.
I mean, I won't say that. Oh, I would use that as an excuse to every small thing. This and that. But no, if there's an issue, there's an issue. It's as simple as, oh, you have a physical ailment. You can have a mental ailment as well.
The funny thing about even the small things is they add up. So even the things where we trivialize and say, oh, not every small thing my mental health, even those things add up over time. And then when the big thing happens, they'll be like, oh, but it was just a small thing that happened. Oh, but they've been adding up all through the years until it became this huge thing that is breaking people. So
Bad stuff. All right. Welcome back to Smooth 98.1 and the Smooth Breakfast. Lagos Talks is what you are listening to. If you're just tuning in, you are most welcome along to the conversation. Ayokunmi here. It's all about International Day of the Girl Child, as I mentioned earlier. That's what we're talking about this beautiful, beautiful Friday morning. We're taking a look at health and well-being, girls' vision for accessible health care. We're breaking it all down, getting perspective, and of course, a lot of much needed information. We are taking the lid off this particular discussion and being very open about it. Heartfelt conversation. Dr. Muti'ah Badruddeen is my special guest. She is a reproductive health physician, and she has been giving us this info. Love it, love it, love it. You can also share your thoughts with us this morning for all the girl children out there, your nieces, your sisters, anyone who's a girl child. I mean, the men are also welcome in on this conversation. This is also something for you to learn from and share with those your loved ones at a later date. Because YouTube, we're streaming live there at Smooth 981 FM Lagos. So you can always go back to the live stream or go back to the stream and then share it across board where you need to. You can also send those messages in once again on 08094440981, 0201 4489981. That is the studio line where you can get across to us and share your thoughts. All right, Dr. Muti'ah, welcome back into the conversation this morning. Let's
thank
talk
you.
about technology. Very, very important when it comes to healthcare. Now, telemedicine and mobile health applications are now transforming how healthcare actually is delivered. I mean, these technologies have the ability to actually bridge the gap for girls in remote areas, possibly. I'm adding that caveat, possibly, bearing in mind our peculiar environment here in Nigeria. And it's going to allow them to consult with doctors, access health information, or even receive mental health support through their phones or devices, if and when they do get there. Digital literacy and internet access are very essential for these tools to be effective. That's why I added that caveat, possible, because we know the issues. Now, I mean, that being said, and flipping it maybe to the more urban areas where at least we know to a degree we have these devices and these capabilities, how can we leverage technology to improve healthcare access for girls, even for those undeserved regions? I mean, if you can bring that into the conversation. And are there even any potential risks associated with this?
Hmm. To be fair, especially since COVID in 2020, there's been an explosion of how much technology has been brought into the practice of medicine. And I think that you mentioned the areas where it is most effective or it has been most used, let me put it that way, which is the dissemination of health information, but also mental health support. So I personally I've had so many opportunities to, you know, hold panels, deliver lectures, workshops, name it,
Hmm.
on in my specialty of sexual and reproductive health across communities that I've never been. I probably will never be in my life. And that's what makes it possible. Right now I'm talking to you from a totally different country. So all those things help to a large extent. I was in a business acceleration program earlier in the year, and one of our cohort was developing a mental health um, screening app. So you go through the app, and then it would support you as much as it can. And then if you needed to see a professional, then it would refer you to a professional, which was really cool because that meant that the one, you had access to the support you needed immediately on your own device, but two, it also meant that you screened out, those quote and unquote smaller issues that you could manage on your own with proper support. And then that
Okay.
also meant that the very few mental health professionals that were available were not, you know, bombarded with too many patients, and they could actually focus on helping the patients that needed their help. So yes, in those two areas, it's been very helpful. And you've already mentioned all of the limitations in terms of the Nigerian Nigerian market. To be fair, we still have problems with internet access, with electricity. I'm still always going to come back to the finances, because how many people can afford all of these things? But I think another part of, for me personally, what I'm excited about in terms of telemedicine is the collaboration between health workers, the ability to share therapies and new therapies, new treatment modalities across different geographical areas. So, for example, you could be in one place trying to attempt a particular surgery that someone else, has the expertise for, obviously with caveats, and then they can get on, a telemed conference with you and walk you through the procedure. It's very exciting for me as a health professional to see those kind of things, and the sharing of knowledge, the sharing of information, not just with the general public, not just with the patients, but also with, fellow health professionals, has been really good in terms of helping to move medicine forward. How does that then translate to the average Nigerian girl? Well, I suppose that means that the information is out there. The problem, of course, with that is they still kind of have to figure out the right or proper information, especially in this day and age of, internet misinformation and disinformation.
Mm.
So that is a problem, I guess. It's not everything that you read off of the internet that is also like true or even relevant to your experience. So
Oh, yes.
there's also has to be that. But yes, it's by and large, it's been a good progress, to be fair. We just hope that someday we have enough of the resources within our own context in Nigeria to actually be able to avail ourselves of that.
Fingers are actually crossed that that would happen eventually. I mean, there are a myriad of issues, but if we're going to get to a point where we can say that okay, things are working to a reasonable degree, that is one way it actually would go, and it's a very, very viable option
Yeah.
to look at. And that being said, looking at the fact that things need to be done in certain ways to make things happen, we can't not talk about the government. Yes, the government need to be brought into this conversation. There's no doubt about it. And I mean, I need to ask this. Um, how can government switch up in terms of the role they play in bringing in policy, in making or in shaping the future of girls' health care? And how can we ensure that their needs are reflected in national health policies? I mean, how key is it that when these policies are being made, that the relevant stakeholders like yourself and other health professionals are carried along in entirety so that what is needed is actually what is put out there at the end of the day?
Mm. So first things first, I think the government should have even come to this conversation way earlier. Because you remember the first thing I said was access, finances. Mm, that's not totally, but a huge portion of that comes from the government. The kind of funding that you need, the kind of ability to make the access possible is something that is very much within the capability of the government and the policymakers. And they should be, I personally think that one of the greatest disservice that we have done ourselves as human beings is the capitalization of healthcare. Healthcare should not be a profit making business. It's, let me not rant on that. But yes, I do think that the capitalization of healthcare is a great disservice. It should be a service that the government offers to the people. And the only way that this can work, the only way that the government can help us make policies and laws and changes and those things that would affect our health positively as a people, but particularly for the girl child, is to actually carry along the people who are on ground doing the work, listen to their voices, figure out what the problem is. If career politicians are making all of the laws based on, I don't want to say personal political self-interest, but unfortunately that happens to be what it is most of the time, then they are not paying any attention to what the populace needs and how those laws affect the population. So, for example, to go with a very out there um, example, will be the
Okay.
Roe v. Wade being overturned in the US.
Mhm.
Now, different people have different opinions about the Roe v. Wade and the right to abortion and all of those stuff. But when that happened, one of the first things I said was, yes, they said that the doctors could still if it was life threatening or whatever, still intervene. But I knew, as someone who works in reproductive health, that once you make that kind of law, doctors are going to protect their own self interest too, because at the end of the day, we are humans. They're going to protect their
Right.
own self interests, which means if there's a possibility that I may be liable to the government because of this law, then they just wouldn't do it. And so that meant that women and girls were going to be denied life saving care, even at the point where it was needed, because people are like,
Mm.
yeah, I'm not sure if this was. And so I think that being able to not just talk, but get the participation of the people who are on ground to make those laws. So, for example, if they are trying to make a policy or a law or whatever, I'm not in politics. I don't know how they do those things, but it's easy for them to collaborate. For example, with the MDCN or the NMA, the National Nigerian Medical Association, or
Station.
something. Say we have this thing in the plan. Can you send it out as a survey to your people who are working? Or what is your recommendation? What is those kind of things to make it easy for the laws that we then make to be beneficial to the people that we are trying to serve. So far, I don't think that we have that kind of system in Nigeria, unfortunately. So,
Mm. Unfortunately so. Let me take a quick message here from Michael before we hop on a quick breather. He says, the mantra, what a man can do, a woman or girl can do better. Has this affected what women and girls should be doing rather than competing with men? I have a daughter and worry about how she develops mentally, physically, and emotionally while discovering herself. We need more of professionals like your guest speaker, Dr. Muti'ah Badruddeen, educating our females. And this is for you, Dr. Muti'ah. He says, how do we contribute to making this a success in terms of funding and support? Now, I know you want to answer that question, but we need to just hold on to that, take a quick break. When we come back in, uh, you answer the question and give Michael some more perspective. Michael, don't go anywhere. Do not even think about switching things up. Lagos, keep it tuned to Smooth 98.1. Lagos Talks. Be back. Interesting question.
hmm.
But I'm just curious. I mean, if we say that, healthcare medicine should not be looked at from the point of view of a profit-making enterprise, then how would it then be kept at the level where it is sufficient enough or it's of high enough quality for the people? I mean,
Okay.
how do you balance that out?
I have an illustration for you, or three. If you look at the healthcare system in Nigeria, which, okay, let's not use Nigeria, nothing in Nigeria works. Look at the healthcare system in Saudi Arabia, which is pretty much free, fully funded by the government. And then the US, which is totally capitalism and private profit making business. And then the UK, which is transitioning from the Saudi Arabian model towards the US model because some people are trying to, make profit out of it. And that makes you realize that it is possible to have this model. It just serves other people to have that model.
Hmm. All about personal interest, really.
Everything always is personal interest, unfortunately. Human beings are particularly selfish.
Ah, beautiful. Anyways, we're going back in. All right, all right, all right. Lagos Talk and Smooth 98.1. This segment brought to you by Emirates. We're having great conversation this morning. We, being me, Ayokunmi, and my guest this morning, Dr. Muti'ah Badruddeen. She is a reproductive health physician. We've been talking about the girl child this beautiful Friday morning. It has been, or it is, an International Day of the Girl Child special. We're looking at health and well-being and girls' vision for accessible health care. The message came in from Michael on WhatsApp. Meanwhile, you can still send those messages in. Join us on the conversation on 0809 444 0201 4489981. That is the studio line if you'd love to give us a call and share your thoughts directly with us in the studio. So back to the question Michael asked. Now he asked, how do we contribute to, no, okay, he said we need more professionals like you, Dr. Muti'ah Badruddeen, educating our females. And then he asks, how do we contribute to making this a success in terms of funding and support as well?
Mm. How do you contribute to making success of really anything? Is to give your time, give your energy, give your money if you have it. And I start with time because that's the one that most people don't or claim not to have. No, to be fair, they don't. But
Mm,
you can find organizations or people or whoever is doing the work that you like, support, you believe is good, and just ask, how can I help? Is there anything I can do? Volunteer, especially people who are doing work in these kind of sectors, something that has to do with healthcare for the girl child, are almost
okay.
always for non-profit, or even if they are a social enterprise like mine is, are not particularly making much profit. So you volunteering will be a lot of help. Give your time, give your effort, give your money. So you can set up a rolling donation for them. It doesn't have to be a lot of money. You can set up a rolling donation, or even more, how's it called? More feasible. You can actually engage their services if they offer for money services. You can engage their services. So it's not necessarily that you're just giving them donation for free, which is good, but you're also helping them to by engaging their services, giving them
Mm,
money in return also, but helping them get more customers, more awareness, that kind of thing. So I think that that's what you as an individual can do. Obviously, keep having those conversations within your own circle of influence. I do not underestimate how much difference that makes. For a very long time, I was always busy with my clinical career. I did not have time to do most of the things that I'm doing now. But one thing I always did do was have conversations with the people who were in contact with me. And I think that that really helped me in disseminating that information to the people around me, such that now that I'm starting an enterprise, it is already something that I'm known for because people have been hearing me talk about these things for years. I hope that
mm.
helps.
All right, Michael, I hope that actually helps. Okay, back into the conversation. Uh, let's talk about community engagement, which I believe is vital in breaking down barriers to healthcare access. Talking about local healthcare workers, your NGOs, community leaders, maybe they can, help bridge that gap by offering these healthcare services directly to the girls that need them. Now, how much more can local communities actually do to improve healthcare access for girls? And is there a way that these community-based initiatives that are out there that can be scaled to have a much broader impact?
Mm. Actually, I am very big on community engagement. It's one of the pillars of SRED. We, I believe, or we believe strongly that communities is where, it's art to use the slang, because people, human beings are not meant to be isolated. And especially when you're dealing with things like issues like this, apart from just being something that is sensitive and we don't talk about or whatever, it's also the fact that one person changing is good, but does not
Yeah.
make any collective impact until we all change as a community. Until that change, there's a critical mass we have to attain for that change to be significant. So
Mm,
when you talk about public health initiatives, for example, or even sexual and reproductive health initiatives, which is what I do, all of that does is it's fine for one person. Even if one person figures out how to, for example, wash their hands often, it is very good. But imagine that everyone adopted that basic hygiene, then we see
mm,
significant more, you know, gains and improvement in our public health issues. And that's how I look at things. That's what we try to do with SRA, is to go directly to the communities and engage the communities. Obviously, even with that, you leave room for personalized services for people who, for whatever reason want special attention or, you know, but particularly in issues of public health, dissemination of health information, encouraging healthy interventions. Communities are the bedrock of any healthy change that you want in any society. And I think that we don't credit that enough, especially in this hyper individualized world that we are all living in now. People think, oh, as long as I am fine, but that's not how it works. We have to be as a collective. It doesn't necessarily have to be everybody. It probably will never be everybody, but as a collective, we have to be fine. We have to adopt these measures. We have to, buy into these ideas, spread these information, whatever you're trying to do. So yes, communities are very important. How do they scale? So it's the same thing about the critical mass I was talking about. If one community has reached a certain level, that whatever intervention you're trying to make is now a communal effort, it would naturally spread out, because every member of that community also has their own circle of influence, where they, who listens to them, interacts with them, learn from them. And so it's kind of like a ballooning, rippling effect. And so that's how it works. I think that the idea that everything has to be big, or at least, everything has to be global, is another disservice that we do to ourselves. It's fine. It's totally fine to start within that community, without your small NGO, in your own small background, and then consistently build upon that and watch things grow. So I think that that's the power of communities.
Consistently build upon that and watch things grow. And I mean, that is a great way to actually look at things. But at the same time, though, I'm just curious, before we take our final break this morning. I mean, in your years of community engagement advocacy, I mean, have you faced any resistance from these communities? You coming in trying to do what you do, but they are wary of, come, what is all this? We're not interested. Have you met any resistance like that? And were you able to, should I say, break down those walls at the end of the day?
I am a Muslim woman talking about sexual and reproductive health. Of course, I have met resistance. Resistance is our daily bread and butter. And just like I said earlier, it's the idea that the mistrust that people have, like, what are you trying to say? Why are you bringing this? Why is it important? We didn't used to talk about it. Why is it? And so, how do we break down those barriers, of people pushing back? It's just to have conversations. I'm very big on conversation, by the way, is to actually have productive conversation. Look, this is what we are trying to do. This is why we are trying to do it. This is how we think it will benefit you. We've had this result in other places with other people. You have that conversation. Sometimes you win, sometimes you don't, but you can only do what you can. You do the best you
Right.
can. That's what anybody can do.
Do the best that you actually can. And, well, as we used to say in secondary school, leave the rest. You've
Yep.
tried your best. All right. Final break. When we come back in, we'll run up on our thoughts this morning on this International Day of the Girl Child Special. It's been a great one. Lagos, it's you.
Ooh.
All right. Final break for the minutes, and then we shall round up the conversation. Time has flown. As I
Yeah,
predict that it would. It always does. It always does. But it's been fun. Very
it
eye
has.
very, very eye-opening as well. Oh, goodness gracious. When last were you in Saudi, by the way?
2022.
Okay.
I left in 2022.
Oh, okay. Oh, okay. You were there for how long?
13 years.
Oh, my dad did 16.
Mm. It's about right. Usually, by the time people have done like 10, 15, you start feeling like, okay,
Early
what's next?
90s, early 90s. Then I think came back finally 2006.
Oh, I left in 2010.
You know, I'm sure things have changed so drastically. It was always amazing how they were always looking to beat the envelope. What's the next
Mhm.
best thing? What's the next
Yeah.
best thing? You always go there, something has changed. Either in the mosques in Medina or in Mecca. It's
Mhm.
always, and like, they're not they're, they're not waiting, no.
No,
People
they're
are
not
moving.
waiting.
And you just wonder, now the same oil we get to,
In fact, don't even start on that one.
because it was always, I mean, every time it's early 90s and all that, lights doesn't blink. I mean, we'll
Mm,
go on holiday for the summer, come back, I'll be robust. I'll be, I get,
mm.
yo, this one and that one. And I'm like, in a few weeks, I'll come back to Nigeria, everything has gone.
Everything has gone.
No, 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 no.
Oh goodness.
Ah, man, if only we had forward-thinking leaders like we
Uh,
actually have.
I don't understand how we ended up with the leaders we ended up with, to be fair. It's horrible.
Let me not think about it. I'm waiting to this, so I don't think about it. All right, welcome back into the final moments this beautiful Friday morning on Lagos Talks on Smooth 98.1. Your love music, love live station. My name is Ayokunmi, and I've been having such a great morning on the discussion this morning with Dr. Muti'ah Badruddeen. She is a reproductive health physician. We've been talking about the girl child today. It is International Day of the Girl Child. If you didn't know, now you know. We've been looking at health and well-being and the girl's vision for accessible healthcare. The theme of this year is girls' vision for the future. I mean, healthcare is definitely one thing that the girl child needs to, have, and we need to talk about it. All right, Dr. Muti'ah Badruddin, it has been a great conversation with you this morning, and we need to begin to park this plane in the hangar, as I love to say. And I'm going to kind of end things like right here in about a minute or so, girls' vision for the future of healthcare. Now, in your work, in your practice over the years, what have you found to be the most common visions that girls have for the future of healthcare? And what can we do to incorporate their voices into the design of healthcare services? I mean, if it's for them, it needs to be something that is tailored specifically to their needs.
Hmm. Interestingly, what I have found is that the vision for healthcare generally, women's healthcare, girls' healthcare, has been the desire for women and girls to be seen as humans in their own right and not as extension of men. I don't know
Mm,
if a lot of listeners know this, but medical research has always dealt with the human body as male being the default and then tackle in a female whatever at the end of it. So there's
huh,
very little research into women's health. And that is very obvious in things like the kind of therapies you have for conditions that affect women only. For example, I
mm,
was talking with someone 2 3 days ago, and we were discussing about polycystic ovarian syndrome (PCOS), and she
PCOS, okay.
wanted to know if she should go get seen. And I was like, well, you could, but unless you had this, you might not want to bother because there is no actual treatment. We've just been managing symptoms. And
Mm,
anytime you say that as a health professional, you feel very sad. But unfortunately, there is not enough research into women's bodies, girls' bodies. And that's what I think girls and women want for the future. How do we incorporate our voices? It's, again, very simple. Just listen to us. Listen to what we actually want as opposed to telling us what we should do or what we should be. It's not so difficult to, I don't know, send out surveys, incorporate women's voices, girls' voices before, coming up with new policies, new therapies, new.
right,
You
right.
just have to have the will.
Mm. You just have to have the will. Thank you very much for the wise words. Before we end the conversation this morning, I mean, for everyone out there who would love to talk to you more about what you do, and of course, like Michael asked the question, I mean, what can we do to support and take this further for more conversations? Where can we find you on your social media handles, Instagram, X/Twitter, LinkedIn, and so on?
Mm. I'm on Facebook, Twitter, Instagram, LinkedIn, all under my name actually, Muti'ah Badruddeen, but my handle is Dean Progress. That's DEEN Progress.
All
So
right.
yeah,
Very straightforward and to the point. Thank you so much once again for joining me this Friday morning. Hope you have a great Friday and a great weekend ahead. It's been a pleasure.
you too. Thank you so much for having me.
All right. And thank you, Lagos, for being a part of Lagos Talks this beautiful Friday morning on the final Lagos Talks of the week. It's been a great one being with you all the way. Keep it tuned. The smooth breakfast is kicking on. I've got Feel Good Friday music that is going to get you into the right mood and the right groove to tackle your Friday and enjoy a great weekend as well.